As a medical consultant, principally I'm involved in the initial assessment and diagnosis, and then the treatment, which you can divide into aspects related to acute treatment and management, and then secondary prevention. I think historically medics have a role as being leaders of the multidisciplinary team. I think there's certainly some disciplines who have more a role at certain times in the pathway than others, but equally I think we all need to be cognizant of our role at all times within the pathway and making sure that all important aspects are addressed.
The stroke nurse's role is to coordinate the care of the stroke patients. Simply, we are the only one of the professions that are here 24 hours a day. All the other professions, medics perhaps see the patients 3 or 4 minutes a day, therapists perhaps half hour a day. We see all the ups and downs. I think we know the patients better than anybody else, and I think we know the relatives better than anybody else. It can be the best job in the world, it can be the worst job in the world. The days of going around your patients, patting them on the head, saying they're there, you'll get better soon, are gone. You have to be quite a tough character because you have to be able to leave this at the end of the day. If you take it home with you, you're on very dangerous territory. But you still have to have the compassion there. And you still have to have some technical ability when it comes to what we do. And those 3 things are actually quite hard to find in one person.
Communication is absolutely vital, and I think one area that is sometimes difficult is the most important aspect of communication is with the patient and the carer.
Teamwork is crucial to what we do. And I think anybody in any of the professions that work on here would have to say that, because none of us can operate without the other people. The therapists need the medics to sort the medical problems out before they can work with them. Nurses need the medics before they can do their job. Therapists and nurses need each other because we work quite a lot together, because in essence, therapists do a washing and dressing session with a patient once a week. Nurses do it 6 times a week. Carol does a swallow assessment on a patient 3 times a week. We do it at every other mealtime because we're the ones feeding the patient. So it has to be a team. It has to be that no one profession gets ideas above the station, if you like. Because although, we say about the professor that he thinks he can walk on water, but he can't actually. But it's absolutely crucial to what we do, and I think that's what makes this work, particularly in stroke, is it is a group of people that are passionate about it. And over the time, we have built that team up. So anybody coming new into it, the expectation is there and the standard is already set.
I think we need to ensure that whether it's verbal or whether it's written, that the goals that we're setting are realistic, they're appropriately communicated, and seem sensible to different teams that may be taking over the achievement of those goals as patients move along the pathway.